Good afternoon, and thank you so much for joining us for Thursdays with AARP Wisconsin. I am Amber Miller, your host and also the Associate State Director. Bear with me, I'm having some allergy issues, but I'm going to push through it, and so hopefully you can hear me very clearly. So before we get to our guests today, of course, please visit the AARP Wisconsin website for upcoming information on virtual offerings, advocacy, and also, if you're interested in volunteering with us, you can visit the AARP Wisconsin website below or AARP/I want to volunteer. So you can find some additional information if you'd like to join us as part of our volunteer family. We're still looking for great volunteers even in our virtual world. Please also remember to check out AARP Community Connection. You can find information about volunteer opportunities in your neighborhood that either are going on or that you can start. And then also information on the Friendly Voice initiative that started last year, where you could put a request in to hear from a friendly voice, which is one of our AARP trained volunteers. You can be any age, you do not need to be an AARP member, and it is free. You can check out the website below or the phone number, which is 1-888-281-0145. You could put a request in for yourself or for your loved one. So we're always excited. Oh, and I might add too, this is pre-recorded. But if you have any questions pertaining to our show today, you could still post them below, and we will make sure that we answer them. So we always get excited when we have our beautiful advocacy team on. So today we have Lisa Lamkins with AARP Wisconsin. Hi, Lisa.
Hi, Amber. I'm so happy to be here.
Always happy to have you. So you're going to be talking a little bit about the booster, and I know you've been on our show before, and I know AARP has done an amazing job just talking about the vaccine in general, but I know there's been a lot of news about boosters and people are like, should I get it? Where can I find information? So I know we're back at the table talking about COVID and the variants and the vaccine. So what is AARP saying about the COVID vaccines?
Yeah, well, you're right, Amber. First of all, unfortunately, we are back talking about COVID and the variants and the vaccines. And I'll start by saying that AARP really does urge everybody who's eligible to get the vaccine and to get the booster shot to protect yourselves and your loved ones. I think so many of us want to just put an end to this pandemic once and for all. And I will say, I just saw a report today that for the first time since mid-January, hospitalizations in Wisconsin are over 1,000. It's actually 1,045 people are in the hospital right now with COVID. And, that impacts all of us because when the ICUs and the hospitals are full with people who have COVID, then others who can't get sick, or the others who do get sick, can't get the care that they need. So, we really do want folks to get vaccinated and protect themselves. Now, just like we did with the vaccine when it rolled out, AARP will again have state by state vaccine guides. And just as a reminder, people can go to it's aarp.org/WI vaccine, and there will be information about vaccines in general and about the boosters because there's still a lot of evolving information on the booster shots.
So I appreciate you sharing information about the vaccine because it is true. COVID is still here. And if I'm not mistaken, I think it's over maybe half the residents of Wisconsin have received the vaccine, which you're like, wow, that's great. But there's still probably over 40% that have not received one. And Lisa, I know you mentioned a little bit about the booster shot. I've been hearing about it. So what about the booster shots, and also what's the scoop, and how is AARP educating members on the booster shots?
Yeah, well, I'm sure a lot of folks have heard that the health officials and experts are saying that people who are already fully vaccinated should plan to get a booster dose about 8 months after they had finished their sort of first go round with the shots. Now, most vaccines started going out in late December of 2020, so folks would be eligible starting September 20th. And those would be the first people who originally got vaccinated: healthcare workers, nursing home residents, and older Americans. Primarily, this is for folks who got Moderna and Pfizer vaccines, is what the data is showing right now. That Johnson & Johnson vaccine didn't really get out there until March of 2021. So they haven't really figured out necessarily from the data if a booster is warranted, but health officials do anticipate that one will be recommended. The FDA and the CDC are still reviewing the data on everything, giving their okay before they offer these booster shots to everyone. I will say that so far, they have recently okayed giving the booster shots to people with compromised immune systems. And we're already starting to hear about folks who are getting the boosters. As always, check with your own doctor to see what's right for you, where you can get it. And just like we did with that initial rollout of the vaccine, we're going to continue to update information on our website about boosters. And AARP has another web page that will also have updated information. It's aarp.org/coronavirus. And there are great articles and great information about going back to the office. What do the variants mean? Even things like etiquette tips on asking if people are vaccinated. Plus, we're sort of ramping up again our regular telephone town halls about current coronavirus topics. And so you'll want to check out that aarp.org/coronavirus webpage for the most up-to-date information on what's going on with the booster shots.
And and Lisa, I know the initial vaccine was kind of a mess. I think we received a lot of emails and phone calls just from AARP Wisconsin members. It was just kind of all over the place. So what is AARP advocating for at the state level to smooth things out this time around?
I think you're being kind, Amber, in saying that the initial rollout was kind of a mess. um,
A little bit.
so, yeah, we are hoping that that the state can learn actually from what happened the first time around. So, as always, AARP, is a big advocate for our members and for their families. So, we have sent a letter and to the Department of Health Services outlining several recommendations when it comes to the booster shots. Just like we did for the original vaccine, we are asking that access to those booster shots is, again, that we're prioritizing people age 50 plus. We know that it's the older people who originally were getting more sick and who were dying. And now we know, again, older people may have more compromised immune systems. So we are asking for that prioritization with the boosters to take place for those people age 50 plus. We are also urging the state and the department to establish a transparent process to make appointments to get the booster shots. That was sort of the biggest mess I've ever had, with people scrambling to try to find vaccine appointments. And we heard from so many people who didn't have internet access or who couldn't go online and make appointments. Hopefully we've learned from that. And so that if there are widespread clinics again, for example, to get the booster at, that we have ways that people can make those appointments. We've also urged that we look quickly at developing plans to get those hard to reach populations, those folks in long-term care settings and people who are homebound. We still have reports of particularly homebound folks who struggled to get the vaccine. And finally, I think, what we learned from the first time around is we don't know what we don't know. And so, what we need to know is who is getting the shot and where are
Mhm.
they. So, we need there to be some consistent and public reporting about who's getting the vaccine and who's getting the booster by
Mhm.
age, by gender, by race, ethnicity, by county, so that we have a really good picture of what is happening and where it's happening.
And Lisa, I've read some reports that there still are some residents and a fair number of the staff who work in the nursing homes that are still not vaccinated. So, what does AARP think of that?
I will be really clear with this that AARP is calling on nursing homes to require vaccinations for staff and residents. And really, here's why. The deaths in nursing homes, both from residents and staff, account for 30% of the fatalities from COVID-19, even though less than 1% of America's population lives in nursing homes. So this is tremendous. There are more than 186,000 people who are connected to nursing homes
Mhm.
who have died. And that is really just not acceptable.
Mhm.
And we're very concerned about the low levels of staff vaccinations in particular. It's a not acceptable level of risk. This disease spreads so easily in these close quarters. And so it's really important that facilities are open and transparent about how they are working towards this goal of getting their staff and residents vaccinated. I'll just say we're not alone in this.
Mhm.
AARP isn't the only group calling for it. There are lots of professional healthcare groups, the American Medical Association, the American Nursing Association. They're all calling for long term care workers to be vaccinated in order to protect the health and well being of the residents who live
Mhm.
there.
Yeah, it's definitely something I've been following, which I just find of great interest. So Lisa, so what if staff in the nursing home or nursing facilities refuse to be vaccinated? What should the consequences be? Should they lose their jobs? And isn't it already hard to get enough workers in nursing homes already?
Yeah, I think whether nursing homes use an incentive like saying, hey, we'll give you $100 if you get vaccinated, or whether they use consequences like you won't be able to work here unless you get vaccinated, that kind of decision, that kind of consequence is really a decision best made by the facility. Um, but as these new variants are emerging, we can't let these problems be repeated when we know there's a way to prevent it. We can't have so many deaths. Nursing homes are paid to provide a service to those residents. That includes making sure that there is sufficient staffing to provide that care.
Mhm.
The facilities can determine how to meet those obligations to provide sufficient staffing while making sure that the staff is protected as well. I mean, I think that nursing homes don't want to throw their staff under the bus. They want those folks to be protected. The fact of the matter is, even before this pandemic, labor shortages in nursing homes were a chronic issue.
Mhm.
It's a really tough job. I mean, it's low pay, it's difficult working conditions, and there are limited benefits.
Mhm.
AARP has actually long been advocating for fair pay, improved working conditions, because I mean, the staff who are working there, they're providing for the health and well-being of really our most vulnerable population. So we really do encourage those staff to take care of themselves and take care of the residents that they're caring for by getting a vaccine.
And Lisa, I do have to walk down memory lane just for a moment. So, from 1998 to 2000, I was a certified nursing assistant at what would be considered a nursing home
Mhm.
for Alzheimer's patients. And we were short staffed all the time back then. So I can just imagine how it is now. And one certified nursing assistant is taking care of 15 to 20 patients. So I appreciate AARP always keeping that on the forefront of ensuring that there's, fair pay. So I appreciate that.
Well, and I'll digress a little
Yeah.
bit with you on that, Amber, in the sense that, there is legislation right now that Congress is considering and that folks have heard President Biden talk about in terms of our, you know, caring
Mhm.
infrastructure. But Congress is sort of looking and considering legislation right now that would really go to help with the staffing shortages
Mhm.
in long-term care facilities. There would be money set aside for things like recruitment and retention, to increase wages, to provide benefits. We know that these folks are overburdened and they are really doing tremendous work. Again, AARP will keep working on that, and thank heavens for the CNAs
Mhm.
that are out there. And I didn't know you had done that job, Amber, so that's awesome.
In my younger years, I wanted to be a nurse. That
Mhm.
was what I wanted to do, and then I was a certified nursing assistant, and as I loved it, it was super rewarding, but it was hard work. It was hard work, so I shifted my life goal, but I give kudos to people in the healthcare field in general, but especially those who take care of our aging population. So, and
Absolutely.
what advice does AARP have for families with loved ones in nursing homes if staff refuses to get vaccinated?
We really do urge families to continue advocating for their loved ones who are residents there. Ask the facilities questions, ask them about their vaccination rates, ask about the safety protocols that they've put into place. And don't be afraid to ask, what are they doing to prevent COVID outbreaks? Do they have enough staff? Does the staff have enough, protective equipment?
Mhm,
How are they relaying information about COVID outbreaks to family members?
mhm.
In fact, AARP has a list of questions on our website. I am chock full of websites today, by the way. This is yet another AARP website. I mean, they're all the same website, but they just take you to different pages. So this shortcut takes you to aarp.org/nursing homes. There's a list of questions that caregivers can ask facilities to kind of get a sense of what's going on related to COVID. We also publish something called the nursing home dashboard, and it reports on the different levels of COVID-19 infections and deaths in facilities around the country. So you can get all of that information at the aarp.org/nursing homes. Ultimately, it really is up to the family to sort of monitor the conditions and to weigh the risks and the benefits of their loved one's living situation. And I know so many families struggled with it during the initial outbreaks. We heard from lots of families who really felt like they needed to be the voice and the advocate for their loved ones. And so, if you need some hints on doing that, check out that AARP webpage for a little bit of tips.
And Lisa, what other I know, excuse me, I love websites. I mean, I always tell people if you go to the AARP website, there's so much great information on there that you can get lost for days in a good way. Like you just like, well, I didn't know about this. I didn't know about this. What are other, excuse me, what other resources or last words would you want to give to our members or their loved ones, especially if they have concerns about, still getting their vaccine, looking for the booster, their loved ones in the nursing home? What would be your comments?
Yeah, well, you're absolutely right. Hitting up the AARP website is definitely going down the rabbit hole. But believe it or not, there are other terrific websites. And in Wisconsin, our Wisconsin State Health Department has a really good vaccine dashboard. You can, see the vaccination rate for your county. You can see COVID cases for your county. You can see which nursing homes in your county have COVID cases. And that website is dhs.wisconsin.gov/COVID-19. And again, that's our Wisconsin State Health Department. And you could kind of go down a rabbit hole on that website as well, but it's a terrific resource.
And we will make sure to put all these websites in on our Facebook, kind of with the description. So Lisa, it's always a joy. We always learn something new from you and such valuable information. And I appreciate you talking about the vaccine and the booster. Like, COVID is still here. It has not gone away, and that there's still information and resources that that you could find on the AARP website. So I want to thank you as always, and thank you for being so kind and plugging along with my allergy voice. I appreciate it. And I have been tested for COVID, just in case anybody asked, and it came negative. So I definitely wanted to make sure that I wasn't spreading that around. So thank you, Lisa.
Well, Amber, it's always a pleasure, and happy to have a short and sweet show so Amber can rest her voice.
I'll be better for the next show. So thank you, Lisa, as always. We appreciate you. And for next week's show, so it will be Falls Prevention Week. We don't want to just highlight it for 1 week. This should be something on the forefront of everybody's mind. So we're going to be having our friends from WEHA talk a little bit about what Falls Prevention Week is and how you can get some additional information and resources. Also, there are some upcoming events that we always like to plug. Thursday, September 16th, Trivia Night, so that is virtual. September 17th, Explore Tech, so mindfulness and meditation. I think we can all use a little bit of that. September 21st, A Beginner's Guide to Claiming Social Security for the First Time. I will be facilitating that. By the 21st, my voice will be 100%. So I would love for you guys to come if you are not to the Social Security age yet, but just looking to get information. So we'd love to have you there. You can register below at the phone number or the website. Also, please remember, small dollar, big impact. Applications are due September 15th. This is for a grant of up to $1,000 for cool, fun, creative, innovative ideas that make an impact in your community. So if you're interested in more information or to apply, please go to www.aarp.org/WI and then SDBI, which stands for Small Dollar Big Impact. So once again, I want to thank you so much, Lisa, always bringing really good information to our members and non-members. Please feel free to share this video on your Facebook. Remember, the more information that we can get out to the residents of Wisconsin, the better. Until then, please be safe, and I look forward to seeing you next Thursday. Thank you so much.